Welcome all. On the occasion of World Cancer Day, DivineMagic Foundation is coming up with a series of episodes on cancer awareness. The first in our series is breast cancer.
Why is it important to create awareness about breast cancer? 27% of women diagnosed with cancer have breast cancer. It is the commonest cancer in our country. 50 to 60% of women diagnosed with breast cancer in India die within an year. So, breast cancer occurs when cells in the breast tissue change, that is what we call mutation, and divide rapidly. These abnormal cells form a tumor. So, how can we diagnose breast cancer or have suspicion that there's something abnormal and we need to see a doctor? There will be discharges from the nipple. It can be a blood stained discharge or a bloody discharge. You can feel a lump in your breast. There will be changes in breast color, pitting of the breast skin, and breast or nipple pain. So, who are the women who are at risk of developing breast cancer? Now, breast cancer can occur in any woman, but you are more likely to have breast cancer if there's a family history, that is, your mother or your aunt has had cancer, there's gene mutation, late childbearing, early menses and late menses, stopping, obesity, increased breast density, prolonged use of oral contraceptive pills, hormone replacement therapy after menopause, and increased intake of alcohol and tobacco use. So the question arises that what can we do to prevent breast cancer? Stop smoking, control your weight, limit or avoid alcohol, breastfeed your baby, be physically active, and avoid exposure to radiations. Now, how does a woman know whether she has breast cancer? The most important and easy method of finding out is by breast self-examination. We'll be seeing that in detail in the next slide. The next is cytological analysis, that is, when you have palpated or found a lump in your breast and you go to a doctor, they do a test by aspirating or taking out the fluid from the lump or the cells and examining them under a microscope. The next test is mammography. So in the breast self-examination, pick the same time each month to examine your breast. Look at your breast in the mirror with your hands at your sides, then above your head. Use the pads of the fingers to feel or for any unusual changes around breast and armpit. Look and feel for lumps, hardened knots, or other changes in your breast. Signs of swelling, redness, or skin dumpling, any changes in the nipples, including appearance, texture, or discharge, should raise an alarm. So, how to examine the breast further? Lie down. While lying down, use the three middle fingers and apply 3 levels of pressure in a circular motion. Follow up and down pattern. Then check for changes with hands on hips and chest muscles flexed. Always examine your underarm while upright with arms slightly raised. So we have discussed about self-examination. The next common test that we do is mammography. Now mammography is indicated yearly in the women who are more than 40 years of age. Now by doing mammogram, we can detect early stages of the cancer, and usually the breast cancer when detected in early stages is curable and treatable. You have more chances to live for more than 5 years, and the medicine, the dosage of the treatment that is required is also less if detected early. So mammogram is something which we should get it done yearly. So the take home message of my talk is eat healthy diet, which should be very rich in green vegetables and fruits, maintain a healthy weight according to your BMI, exercise and meditate regularly, do breast examination frequently, mammogram yearly, stop smoking, avoid alcohol, have proper sleep. Usually the sleep amount that is indicated for a healthy life is between 10 p.m. to 5 a.m. Breastfeed your baby. When in doubt, see your doctor immediately. Thank you so much for your patient hearing.